COVID-19 vaccine hesitancy has been understudied among marginalized populations in rural India. To understand the motivations for and barriers against vaccination, we surveyed 6,319 adults across 32 districts in the states of Uttar Pradesh and Bihar in March and April of 2022. A third of our sample was each unvaccinated, partially vaccinated, and fully vaccinated. This is what we wanted to know. Firstly, did hesitancy get in the way of vaccination? To answer this, we looked at the subsample of the unvaccinated. 58.2% of the unvaccinated had tried to get the vaccine. Only 20% said that they would never take the vaccine. So even among the unvaccinated, there was high intention to vaccinate. Secondly, what were the barriers to vaccination? When we asked unvaccinated people why they chose not to get vaccinated, the most common answers were that they were either pregnant, breastfeeding, or had a pre-existing chronic health condition. Only 4.3% of this group mentioned they had acted on a doctor's recommendation or had even consulted one when choosing to not vaccinate. Thus, many of these holdouts may be due to misinformation about eligibility rather than genuine medical complications. Thirdly, what were the attitudes towards child vaccination? 89% of adults said that they would vaccinate their 15 to 18-year-old children if an approved vaccine were available. Using a video experiment, we further tested two ways to increase vaccination intent. Participants were shown one of two persuasive videos, one with an emotional story and the other with a rational case. The rational script increased intent for child vaccination among unvaccinated adults and was rated as more trustworthy compared to the control. The emotional script was no different from the control on these measures. Our survey revealed that the last few holdouts were not due to distrust in the vaccine or disbelief in the COVID-19 pandemic, as much as misinformation about the interaction of the vaccine with pregnancy and pre-existing health conditions. This suggests that policy intervention should focus on providing credible information through targeted messaging, as those most urgently in need, people with comorbidities, are disproportionately left behind.